I guess you call it full mouth reconstruction. What is it?
Basically, it's revitalization of what you used to have. You don't have it anymore.
Like an extreme smile makeover kind of thing?
Yeah, some people call it extreme smile makeover. I mean, certainly when we do these things, we make them look good. We go out of the way to make sure they look beautiful because now we can match all the teeth. And as you know, you might see somebody who's had dental work a long time ago. They had crowns put in and they look really white now because guess what? I was 20 years younger when I had this thing done and all my teeth darkened with age. So when we're doing full mouth reconstruction, a lot of times the reason we're doing it is because people have failing teeth. They're breaking, maybe they have a little bit of gum disease here or there, and they're having issues with their teeth, and maybe they've worn down their bite and their face is literally getting shorter and they look older. Okay. So sometimes what we need to do to fix their bite, they may come in and say, hey, I snapped off this front tooth. This has happened many times. I just want an implant here. And I say, yeah, but you've worn all the teeth down and we need to re-raise the table, give you a facelift, give you back what you used to have there, and we're going to crown all the teeth to do that. And so we're basically rebuilding their bite back to where it used to be before they wore it all down. And while we're at it, we're going to give them a gorgeous Hollywood smile at the same time.
Now, we should mention, you do just about everything under one roof. I mean, normally you'd go to the endodontist for a root canal, maybe the periodontist for something else, the oral surgeon for something else, prosthodontist for something else. You do it all right there.
Yeah, we do everything in-house.
You have your own lab.
We have our own lab, and I actually am very intimately involved with the design work. So I have another doctor in my practice who's doing a full mouth rehabilitation, and we are actually doing digitally with a patient's face, their picture, mocking up the smile before we ever touch their teeth. We're designing the teeth
on the computer first.
On the computer.
Is that right?
And we can show the patient the picture on the computer, what they're going to look like before we even start.
What do they say?
I mean, they don't realize what they can have.
Do they point and say, I want that?
Absolutely. The acceptance rate on that is amazing because when they see what they can have, it takes away the risk because they're not sure. Because the old way of doing things, Randy, maybe I think it looks good, but maybe they're afraid that they're going to spend all this money and it's not going to look good. I can do it in advance and show them before we ever start. And it's going to match. When we get done, it's going to look just like that when we're done.